Hi, this is Teresa Kenny from the Hormone Genius podcast. I'm here with my co host, Jamie Rachi, and we are together today to do a fantastic episode that is going to give an overview of fertility awareness based methods, otherwise known as natural family planning, so that you know what your options are. And this is a lot of content. It's very exciting because the world of natural fertility has exploded in so many ways, but there is still kind of this foundation of really structured methods that we really want to go through so that you know what your options are and you feel confident about choosing what's best for you. So,
Yes,
Jamie,
yes.
let's
This is
get
such an
started.
important, it's such an important topic. And I've said this a few times, but when I was in college, I wanted to learn more about the different systems. And so, granted, that was over 10 years ago, but I learned that it's not just one thing. When people say, oh, I'm going to use natural family planning or I'm going to use a fertility tracking system, that doesn't point to just one thing. It's actually several things. When I say things, I mean several methods. There's many ways to practice tracking your cycle because there are many ways to look at your body and know when it's fertile. And so that was one thing that I learned as I was doing my own research as a master's student that totally struck me. I thought, what? It's not just the temperature, which is what I had always learned, that your temperature shifts and that didn't seem right because there are so many things that might affect my temperature. So no wonder people think natural systems don't work well because your temperature can be kind of wonky if you had wine the night before or cold medicine or you slept strange or whatever. So we're really excited to dig in to this topic with you all because there are so many options for you, and based on the season in your life and based on your goals might gear you toward a specific method. So today again we're going to be talking about some of the more popular methods out there. We're going to explain just high level what these systems basically, like the main method or the main how to with some of these systems. And yeah, we'll just have a conversation back and forth. But again, for those of you who are confused by this or think it's one thing and you think if you use a natural system you're going to get pregnant and you're trying not to, just know you might not have the system. You might not be practicing the right system in the right season if you're nervous. So just know there are options.
Yeah, absolutely. And basically, it always gets back to a foundation, Jamie, for us of this is about understanding our bodies. It's about the knowledge, the education, the empowerment that comes from understanding as a woman how our menstrual cycles work and
Mm-hmm.
how we can be in tune to that, which of course relates to our ability to have babies and not have babies, but it also relates to health as well. And that's why you say, this is about where you're at in your life. Some people's goals for tracking their body and their cycle are completely different. But no matter what, how you track, it's all going to be the same. Why? Because biology is always the same. So we want to, start with just the very basics of this is how we look at biological markers of fertility and how you track them. So you could kind of break up cycle tracking into different methods by biological markers.
Mm-hmm.
So we'll start with the cervical fluid, maybe, or the methods that use cervical mucus as tracking, and just explain kind of how that works and what methods are the most common for that. So, do you want to get us started on that, Jamie?
Yeah. Yeah. So there are several mucus methods. So just like I said, there are many fertility awareness systems. Like high level, there are cervical fluid methods, just like Teresa said. And then there's also methods, just high level, so you know what you're getting into here with this episode. There's also sympto-thermal, sympto-hormonal, calendar, lactation methods. So this is the first one we're going to dig into, the cervical fluid. So within the cervical fluid, like umbrella, typically, you all know probably by this point that we treat both Teresa and I are trained in the Creighton method. And so that is one that both Teresa and I have strong familiarity with. Also, Billings, the Billings method and the Creighton method are very similar. And let's face it, all of these have that component of mucus. So, again, as much as Teresa and I can, we'll try to kind of pinpoint what the differences are. FEM uses cervical fluid, the 2-day method, and there's Family of Americas, which I can say I'm probably least familiar with. I do have familiarity with Creighton, Billings, FEM, and 2-day. So we can kind of talk a little bit about what those differences are. So let's start, Teresa, with Creighton, since it's the one we know most often. Teresa, would you say, let's have this question I want to ask you here. When women come into you and they are new women, like new patients, would you say that these women like are coming to you because of the Creighton system in general, or is it because they've heard that you don't prescribe birth control? And what does that first appointment look like when you're trying to explain to that woman, her options and more specifically Creighton? Like, how does that conversation begin, and how does that woman respond to this basic information that she have never been told?
Yeah, I mean, I think almost exclusively most of my appointments when women come in, they do not come in saying, I would like to learn about the Creighton model system or the Billings ovulation method. They come in because, like you said, they're interested in learning about their health for some reason. Maybe it's a problem that they're having, maybe it's infertility. Maybe they don't even know they're looking for the information. Maybe they're young and we just have that conversation in terms of education about their cycle. So at that point, we start to dive into, okay, well, if you're going to learn how to cycle track, what are your options? And I think we can tie Billings and Creighton model really together, because the Creighton model system is actually built on the Billings ovulation method. So the Billings ovulation method was introduced by Dr. John and Lynn Billings, and they were Australian physicians, and they devised a system to track mucus, but it's what we call subjective mucus system. So it's based on a woman's ability to assess sensation and wetness and kind of how it feels on a daily basis at the opening of the vulva. Creighton model took that, and Billings is great. It's very easy. It's taught very standardly, very systematically. It's very effective. Creighton model was built off of that, and Dr. Thomas Hilgers of Omaha, Nebraska, took the Billings method and basically standardized it in a different way, to the point where he made mucus objective and quantifiable and gave it almost a language, you could say, for women to describe it.
Mm-hmm.
And it's a very, very standardized system in that way of tracking mucus on a daily basis.
Mm-hmm.
So what that looks like is just that, first day of your period, you mark your bleeding days. At the end of the days when they become light, you start to track mucus every time you're in the bathroom. And you have a way of basically creating a language around, tracking that mucus. You can identify the fertile window very accurately, because mucus changes, of course, with the cycle, as we've talked about on this podcast many times. And once the mucus and fertile window closes, your mucus dries up again.
Mm-hmm.
So those two are very kind of tied together, I feel like.
Totally. And it's so cool because what Teresa, you just mentioned, is one thing that I really love about Creighton is the standardization of the observations. While I do like that Billings idea, and again, it just depends on, your reason and season in life in terms of what method you choose. I like Billings, their idea that women kind of sometimes just intuitively know based on how they feel. I like that part, that they're tapping into that like feminine understanding of our body. It almost teaches you to understand it more. What is it trying to tell us? I like that idea. But for people who are more data driven, I like Creighton in that, these observations, they mean something. They mean something. And not all cervical mucus may actually, well, I should say, not all discharge is cervical mucus. And so that's another difference, that as a Creighton practitioner, you really begin to understand and learn and know like what sort of discharges may, maybe even be cause for concern, where they need to be referred to a medical doctor. So I always tell people, I'm like, I could look at a chart from a woman in China and not speak Chinese, but know what her cycle is like based on the standard understanding, the standardized observations that we make. So anyway, I love that about Creighton. And I think a lot of people who are data driven and research driven can see and understand why that's important when collecting data, because being, less objective, or is it more, I always get objective and subjective mixed up. Objective is more opinion, subjective is more, yeah, by being more subjective. Did I mix it up? Other way
Yep.
around.
Yep.
You guys know what I
Objective,
mean.
yeah, is like, yeah,
Why
not
did they make those
opinion.
two words seem so similar? They shouldn't have
Yeah.
done that. But anyway, so yes, that's what I love about Creighton. So okay, so there's Creighton, we talk about Billings. Now let's talk about FEM. So
Mhm.
FEM, I feel like, is kind of raising in its popularity. I do know that as far as this point in time, the studies and the effectiveness studies with FEM, while I know that the research points to the direction of it being very effective, I think that they're still somewhat new in that they're still gathering that data. What I like about FEM is the cute app that goes with FEM. So it is based on cervical mucus, but they do tie in LH strips, LH strips, and then also you can tie temperature into it too. So it gives you the tools, but they're primarily based on the cervical mucus. I would say though that the instruction, or the quote unquote rules, are more, I'd say, confining. So after learning Creighton and after learning FEM myself, there are more days of infertility with Creighton, where if you and your husband are, trying to plan intercourse, there are more times you can do that with Creighton than you could with FEM. So that's just another thing to think about. But I do like how FEM is more geared toward like the millennial. It's a cute app. It tracks other things like your emotions and the way you feel, and that kind of thing. So
Yeah. I have a lot of my college students that have happened upon FEM, and they're using that. And I would say it's definitely marketed a little bit more towards health and not
yeah,
for family planning. I think the market there is to drive young people to learn their body and to chart, although I think they can kind of give instruction for family planning at some point. But
yeah,
yeah, and I always kind of give a caveat because they haven't done studies on FEM for family planning. They have
right,
used kind of, Creighton model and Billings and other people's data to show this works the same because it is the same, we're tracking the same, but
right.
a caveat in that. But both FEM and Creighton model are similar because they both have devised kind of a way to medically manage women's health problems with those charting systems specifically.
Mm-hmm.
And Creighton model is attached to NAPRO technology, and FEM is attached to something called FEM medical management. And both have additional educational programs for doctors, providers of healthcare, so that they can learn how to do those medical
Mm-hmm.
management.
Yeah.
And that is very, very, very useful, obviously, and something that I use in my practice all the time.
Yes, totally. All right. So the last one we want to talk about is the 2-day method. The 2-day method is a system I learned again while doing my research on different fertility awareness systems over 10 years ago. And the 2-day method is commonly used in developing countries because of the ease of its use. It's very easy to understand. Also, you don't like need anything besides just your eyeballs, essentially. So what you ask yourself, the 2-day method, is this understanding of your, again, cervical mucus. And you ask yourself this question: did I see cervical mucus today? You ask this at the end of the day. Did I see it today? And then you ask, did I see it yesterday? And if the answer to one of those questions is a yes, then you do not have intercourse that day. So if I had cervical mucus yesterday but not today, I consider myself fertile. If I have it today and not yesterday, I consider myself fertile. And if I have it both days, I consider myself fertile. So the key would be you want 2 days in a row where there is not mucus. So both Teresa and I know, and maybe some of the listeners know, that actually that fertile window following ovulation, just in regards to the systems we have learned, can kind of go up to 3 or even 4 days. So the effectiveness of the 2-day method is not as effective because there aren't as many days following that dry day, but in a way, it could include that, because you might have had a cervical mucus discharge yesterday and not today, and then tomorrow have nothing. So it might be built in a 3-day post mucus discharge. And we know too that often discharge dries up and that as we ovulate, it's the day that's most closely associated with some of the discharge that's really clear, stretchy, lubricative, but it doesn't mean that we won't have mucus after. It just means it might shift and then dry up completely. So with the 2-day method, I could see it working well, especially in countries where they don't have the means. And I could see it also including, like a built-in I don't want to say protection system, but kind of, in that all mucus is considered fertile, whereas with Creighton it is, but you can kind of count out of that fertile window faster. I don't know if that makes sense. Would you say, Teresa?
If you want to learn more, about the about 2-day method, and I think some of the methods that are based on, a little bit easier use and not technology or using the strips, the Institute of Reproductive Health at Georgetown University in the United States have done a lot of research on this. And I think they have a kind of a global awareness that not everybody has access to
Right.
these devices and even thermometers. And,
Mm-hmm.
so how can we make an option for everyone that's natural? And the cool thing is there are a ton of options, like the 2-day method. There's something called the standard days method.
Yep.
There's cycle bead methods. I just read about one called couple beads. These are all things that are being developed, and again, allow for people in every area of the world to be able to take advantage of something that's a natural family planning.
Yeah. Yeah, it's so cool. All right, let's talk about the next section. So we went through the cervical fluid methods. Let's talk about sympto-thermal. Let's talk about the sympto-thermal methods, Teresa. Which one do you want to talk about first?
Well, I mean, I think couple to couple league is kind of a well-known one. I have a lot of clients, patients that have used couple to couple league. They have a ability to attract or to look for cervical mucus, but temperature is kind of the foundation still. It's based on tracking basal body temperature right away in the morning before you get out of bed, before you drink, before you pee, before you do anything. And the science around basal body temperature is very good, and it's been around for 35 plus years. So, even now we've got the Apple Watch is using basal body temperature in women and tracking. So that technology is very solid, and many systems have been developed out of tracking temperature. But a lot of people combine, different
Mm-hmm.
biological markers to help women understand, things better. So I think that's what's cool about it is with the couple to couple league, you're using temperature, cervical mucus awareness. They even have an ability to check the cervix, to literally feel the cervix and to know
Mm-hmm.
the changes of the cervix, through the cycle. And I think that's the one where sometimes people are like, maybe not for me always, but that's really getting in touch with your body, and it could be great for some people to use that as well.
Yeah, my husband and I used it early on in our marriage, and we were getting trained in the couple to couple league system. And so, yes, what I like about it is for those of you who are just so fascinated about your body and what your body's telling you, it's so cool to see all the like inner tangles of what your body is telling you in terms of its fertility. So just as a little FYI, so as you progress throughout your cycle, we know, okay, we have our period, and then typically it's a number of days that are dry. And so, but not always, but let's just say for this example, and we just talked about cervical mucus methods, right? So about mid-cycle, but it varies and it ranges. A woman starts to notice some like characteristic type of discharge. It could be sticky, it could be yellow, pasty, cloudy, and then it starts to loosen up throughout the cycle where it's stretchy, clear, lubricative. And as it's getting more that way, like more abundant in like slip and slide sort of egg white central, that's when we're getting closer to ovulation. And then most women notice a huge shift downward, kind of like I was trying to explain with the 2-day method. Like you notice like there's a bunch and then there's a little, or there's a bunch and then there's none. And then that day where there's a bunch, and again, you want to work with a practitioner on this, that day where there's a ton, typically, we closely associate that with ovulation. All right. But when that's happening, so you're noticing this mucus buildup, but after you ovulate, what happens is you notice a temperature increase, because when you ovulate, after you've ovulated, the hormone progesterone is your main, like your dominant hormone, it should be. So that progesterone creates a higher temperature in a woman. And so that's kind of a sign that you've ovulated. And you need 3 days in a row of a temperature at least of zero 0.4, I believe, 0.3 or 0.4 higher than the days prior. So there's more to it than that, and you'll want to work with somebody to get that. But it's just so cool to see that. And also what happens is Teresa mentioned that you can check your cervix. So your cervix, your cervical position, and the firmness or softness of your cervix also gives us information about our fertility. So when our cervix is soft and open and higher, that's that's a sign of fertility. When it's low and hard and closed, when I say closed, there's a cervical canal, like an opening there. You can tell. It's kind of like the texture or the feel of like what your nose would feel like. It's kind of like that kind of feeling, and almost I think of like a mini donut with like those donuts. Mm-hmm. That's like what your cervix is like. So you'll feel like it's open or it's closed. So we call that the biological valve, but some people check for that. So that's a kind of overview of like the sympto-thermal methods. Is a combination of those things.
Yeah. So main point, progesterone happens only after ovulation, and progesterone is thermogenic, and mm-hmm. it's a retrospective thing. So it's not, temperature is going to tell you that something already passed because it, as it raises. So I like to refer to it as a retrospective kind of biological marker. The cool thing is if you thought you were pregnant and you didn't want to do a pregnancy test, you could actually know you were pregnant if you've missed your period by just taking your body temperature, because in pregnancy, your body temperature will stay above 98.1 degrees. And so, and I've tried that a couple of times when I was pregnant just to kind of check it. And because right before your period, your temperature will drop back down, and that signals the loss of your progesterone, and your period, will start. So kind of a cool little tip there.
So and it's waking temperature too. So someone might hear you say 98.1 and think, what? 98.6 is the temperature, is like the normal. So waking temperature, you're always a little less warm.
Well, and 98.6 always drives me crazy, because everybody thinks that's like the normal body temperature. And even honestly, like not just waking, most people's body temperature does not stay at 98.6. It's usually below 98. So if you take your body temperature and it's 97.5, 97, that's typical.
Yeah.
But again, after ovulation, it does usually go above 98.1.
Cool.
All right. So Marquette method. This is a really fun, popular, I feel like, method that a lot of my patients use, and it has kind of special benefits, I feel like, in the postpartum period and even for perimenopause. So I haven't used Marquette myself, but like I said, I have a lot of patients that have used it.
Yes. So yeah, Marquette is a system where I know the mucus is tracked, but you're also utilizing a clear blue monitor where it's checking your LH. I'm sure you could probably use LH strips too, but I know that they use the clear blue monitor. If you remember when we were talking about cervical mucus, we talked about FEM, and FEM is using mucus, but it's also even using LH strips. So you're going to see some interweave between all of these. And that's why at the very beginning of the episode, Teresa and I said, well, you might decide, to switch around. So if you do switch around, you'll know maybe already half of the new system because you learned it from another one, although there may be differences. So Marquette is wonderful. A lot of people who get frustrated with tracking their cycle, like let's say on paper chart with Creighton or Billings or whatever, so even sympto-thermal, if they've had a baby, Marquette seems to be a really great system for people who are nervous about maybe getting pregnant again after having a child, the postpartum time. So I hear that a lot, that a lot of Marquette instructors are busy with women who are breastfeeding. Have you heard that too, Teresa?
Yeah, 100%. Yeah.
Yeah. So there are instructors, the Marquette instructors need to be nurses, which I think is really cool as well, because talk about like shaking up the hospital system, if there's a bunch of nurses that want to get trained, or if there's a doctor who'd be willing to work with these, I mean, that like gets injected into the hospital system, hopefully. So if those of you listening are a nurse and you want to learn more, Marquette is a great system, and it might even perk some interest for your fellow nurses or others in the hospital that have some same convictions as you.
Yeah, and
So
I love that Marquette continually does research, and you can find a lot of their research online. Dr. Richard Faring was the original developer, and he just continues to provide more research into the current medical literature, which gives credence to, again, the effectiveness, the value of these systems for all women and for families out there. So that's great. What else can we say about Marquette? I think, my patients find it easy. Men seem to like it because of the data. I think the data that comes from a machine also is kind of helpful. I think men kind of can wrap their brains around it. So I've seen that happen as well. And it is a little bit more cost cumbersome for some. So that can be a downside, just because it is an expense up front to buy the monitor, and you have to continually buy the strips as well. And for some women, they're going to use 10 days of strips, and for another woman might use 15 to 20 strips per month. So there can be some variation in that as well. But they have great instruction, like you said, Jamie, and there's a lot of information online about Marquette.
And if you're on the cusp, if you're listening and you're on the cusp because you are so frustrated, maybe with the system you've been using, it seems like the people I've worked with who just need one more thing, like in terms of feeling comfortable about their fertile window, especially for them trying to actively avoid, it seems like Marquette just really helps them too, with having that comfort. I would say Marquette is like, I would say, a VIP for those who are actively trying to avoid pregnancy. I see that being one of the more popular reasons it's being used. I wouldn't maybe necessarily, just personally, point them in the direction of Marquette if I know that there is a health or underlying condition where there may be like the need of surgery, let's just say. So if somebody's really struggling, I would want to know that they would be able to get connected with a doctor trained in a fertility awareness system, and even like a surgeon, like with NAPRO technology. So that's kind of how I think of it. Is NAPRO technology is like really great for the surgery need, wouldn't
Yeah.
you say?
Oh, yeah. I mean, it's just, yeah, NAPRO technology, again, doctors are very specifically trained, and it is attached to the Creighton model system. So there's just an additional benefit of getting, extra support and care, and possible, doctors who've been trained in surgery when you chart the Creighton model system. And I agree, for my patients who have infertility and issues with tremendous amounts of pain, ovarian cysts, anything really, really intense with women's health, I generally steer them towards Creighton model.
Yeah, yeah. So that's just kind of a good way to think of it. All right. And then lastly, before we talk about maybe what's to come on the horizon for tracking your fertility cycle, is the lactation methods. So we've all heard, right, Teresa, of people who are like, what? I thought I wasn't supposed to get pregnant when I was breastfeeding, but here I am, pregnant postpartum 4 months or whatever. So we call it ecological breastfeeding or lactational amenorrhea. And that's the idea that when you breastfeed, and again, it makes sense. It totally makes sense. But when you breastfeed, there is a hormone that's released. It's called prolactate, and that's supposed to suppress the work of your ovaries. It's supposed to suppress all that. And so, what's again supposed to happen is the more you breastfeed, the more prolactin is released, and then the less likely you'll ovulate. But what happens is when women, like, go back to work, or just some women are different, where maybe there isn't as much prolactin being signaled, or maybe they're not, their baby's sleeping through the night, or whatever the case is. But it really just has to happen once, where there's a span of time, a 4 to 6 hour chunk of time, let's say, a couple months postpartum or beyond, where it can trip, your ovarian function. The prolactin can dip down enough where then your ovaries start picking up. So I think of myself, and I don't know, Teresa, like for you, I think I don't know how much you breastfed, but for me, I got my period 4 months postpartum with almost all of my kids. And like they varied. on like how often I breastfed and if I pumped. And so it varies basically. So I wouldn't
Yeah.
say that that's a super effective way to avoid pregnancy. It might be a perk for some where they say, oh, it looks like I'm not noticing cervical mucus. I'm not noticing any sign of fertility and I'm breastfeeding. That makes sense. But for some others, I would say partner with an instructor, maybe especially in Marquette.
Yeah. Yeah. And it's probably different globally than it is maybe for,
Yeah.
Western women, just because I think our lives are a lot more crazy,
Yeah.
in terms of like pumping and working and raising kids and being all over the place. So that may make a difference rather than kind of the traditional ecological breastfeeding.
Yeah.
But there are a lot of women that can use this effectively, and you kind of have to know yourself and know your body that
Yep.
literally it doesn't they can breastfeed minimally and they still keep their
Yeah.
periods away. I think it's good to know that you can ovulate before your first period postpartum. That's always just a standard thing I always share. So that's why it's important to, I think, have another way to track the biological markers, and mucus tracking is an easy one to do so that you can, see that your fertility is a possibility.
Yeah.
And so this is the caveat of all of these things that we're talking about today is that, we really believe that working with an instructor is incredibly important and helpful, especially when it comes to using these systems to avoid pregnancy, because you need the individual instruction to be able to understand your own body. And people who have been trained in these methods, their job is to help you with that, and they have been, highly trained in these systems. So
Mm-hmm.
please get an instructor. And if you don't know where to start, we interviewed Bridget Busacker, who started the managingyourfertility.com, is a great resource, or FABMbase.org is a great resource in terms of just getting an overview of all the systems, and like plug in your address and you can find a teacher in your area. So we just really encourage that.
Yeah, totally. Yep. And then let's pivot, Teresa, into some femtech convo. So, those ladies who are listening, you might be thinking, well, I don't use any of the systems that Teresa and Jamie are talking about. I use my phone. I use just an app on my phone, whether it's the Flow app or whatever. I don't know all the names of all the apps. And we're going to talk a little bit about just what you need to be aware of with those, and then we'll talk about a little bit like of some monitors. I'm doing an experiment, and I'm going to tell you guys about it here at the end. But first, let's talk about the apps, Teresa. Like, what would you say? What's your general opinion of the apps?
Yeah, I mean, my general opinion is that I think it's great that we have access to apps that we can track and learn our bodies. My
Mm-hmm.
general opinion is it a super positive.
Mm-hmm.
I read just, this morning that menstrual tracking apps are the fourth most popular app for adult women and the second most popular app for teens.
Oh my gosh,
So
that's
it's
awesome.
it's really, really a big deal. And I also read that in 2025, the femtech industry, which is just all of this that relates to anything that's technology that tracks your cycle or gives you information about fertility, or it might have to do with health tracking, is a $50 billion industry. So there's a lot of people like interested financially in this area, but it is a positive because it is going to continue to get better, basically.
Yeah.
But whenever I talk to a young woman, an adult woman who's using an app, I always ask the question, I'll say, can you tell me when you ovulate based on your tracking your app? And if she turns to her phone and she says, yes, it tells me I'm going to ovulate here, then I always have to do a, let's re-educate here, because again, a lot of people think truly that the app itself is predicting ovulation. Dr. Duane's organization, Dr. Marguerite Duane, who started FACS, Fertility, Appreciation, Collaboration Team to Teach the Sciences, has a study done in 2000, I think 15 or 16, on all the apps that were available at that time, which now there's probably 100 more,
Mm-hmm.
to see which ones actually target the fertile window correctly. So you can get access to that study. In fact, we'll link it in our little show note, so that if you're using an app that is actually predicting the fertile window or not. Now, you can use these, and you can probably add your information about cervical mucus and things like that. But, the app itself doesn't predict anything.
Right, exactly. And so, yes, it's so cool that women are wanting to get to know more about their body, what's their mood like, how do these things shift as they progress throughout their cycle, their mucus, their period, all of that. But it is very, very true, I would say. And it's this idea of, wanting to honor our body and the beauty and understanding that our biological markers can actually give us effectively. And my fear is that people will have an ill experience with trying to avoid pregnancy using an app alone and giving it a bad name in a sense of it doesn't work. So that's always my hesitation is they're so amazing, they're so great, but if you're actively trying to avoid pregnancy, please meet with somebody because Teresa, I think you've said this before, like you can't pee on your phone. I mean, you could, but your phone's not gonna like tell you. But guess what though? I'm going to talk to you about how you can pee on a strip and put it in a little thingamajig and put it on your phone, which is going to lead me to sharing with our listeners the experiment I'm doing. How about that? Do you have anything else you want to share about apps? Okay. All right. So, guys, listen. I was on Instagram, and of course, you know how like social media picks up on your search history, yada yada. So it's always like throwing stuff at me about like fertility and monitors and blah blah blah. And I was like, okay, there's this one thing. I'm like, no, how can this be? It tracks your estrogen, your LH, your progesterone, and your FSH beta. They're doing a beta on that one. Okay, so here's the thing. With LH, that's the Marquette method, right? And like FEM, you can do LH strips. The estrogen, I don't know if Marquette, I don't think so. Does anybody know? Do you know? Does
I
anything
thought
track estrogen?
I no, I think Marquette, they test estrogen and LH because
Okay.
again, it's picking up the rise in estrogen and the LH peak.
Okay.
So you have to really have both. Otherwise, you're only going to pick up the 24-hour peak, which that
Yes.
wouldn't be effective.
Right. So the thing I love about this, it's called Anito. Inito, Anito. And I do have a code, Jamie15, truly. I hadn't even used it yet. And I'm like, can I get a code? Because this is going to change the world. Because it checks your progesterone. And so I'm telling you now, guys, I'm only on like day 7 of testing this. I'm only on day 7. I have no idea. So if you want to try it, go for it. It's $149. If it's 15 off, it's 120 something. I don't know. But I cannot say, like, I'll have to report back and be like, oh, this is how it's going for me. But so far, it is testing my levels. I'm at peak fertility right now, and that definitely corresponds with my cervical mucus. What I'm most excited about is the progesterone readings because there is something called the Prove strips or tests, PROOV, and I was pumped because it tests if you've ovulated, it checks for progesterone. And for people who are actively trying to avoid pregnancy, that progesterone, just knowing that exists is so helpful because if your progesterone is at what level is it, Teresa? Do you know?
3.1.
3.1 or above,
Mm-hmm.
it means you have ovulated. So for those who have serious reason to avoid and you cannot get pregnant, but you don't want to be on the pill and yada yada, that's how you know. So it is checking urine. It's not checking the blood, obviously. So it does track that. And then also it tracks your progesterone, I believe, as you finish throughout the cycle to know if your progesterone is lower. It tracks and it plots it. So it really is a pee strip that you put in a little thingamajigger that you hook to your phone and it's connected to an app and you see the hormone levels plotted on an app. And so far it's cool. It's lining up with what I'm seeing, which makes sense. But Teresa, I wanted to share that with you.
No, it's amazing. And I know, I mean, this is just like, again, things are just coming together, you could say,
Yeah.
right? I mean, we had pieces and people were putting the pieces together. And it
Yeah.
seems like finally, like, there are now companies that are like, no, why aren't we putting this all together? Like, why can't we monitor the cycle from start to finish
Yeah.
hormonally instead of just a piece of the cycle?
Mm-hmm.
So I know Mira is another one that also does those for tracking for the urine strips too. So this is only going to be new and better improved over time. But like I said, the caveat Jamie and I make is that, this is new. It's not quite fully researched in terms of especially avoiding pregnancy. So we
Yep.
always have to remember that.
Mhm.
But there's such great news in the femtech world, that people really care about this and they want to improve women's ability to understand and know their body and to be able to make really confident decisions around, spacing children. So what great news for all of us.
Oh, such good news. Oh my gosh, Teresa. And it's so important for women to have community too when doing this. It's so important. I mean, think about the olden days when we lived in villages and breastfed each other's children. Like we were talking about our fertility with our friends. It might have been taboo with the men or whatever that was like back when. But I mean, this community is important. And I think that's what I think about too when as you know, Teresa and listeners, like I'm training women to become hormone coaches. And that's more of like the hormone health doula, like that I'm going to journey with you. I'm going to help you understand what questions to ask your doctors. I'm going to help you get to the root of some of these cycle issues that you're having. So, not necessarily to avoid or to achieve pregnancy, but just health related in general. But either way, like to have that support sister with you is so important, and to have a fertility awareness instructor with you rather than just this isolated, solitary thing. Again, some people are cool with that, but if there is a goal you have a goal of achieving, you have a goal of avoiding, or you have a goal to get to the root of why your cycles suck. On a scale of 1 to suck, it sucked like terrible. Then I just want to encourage you to reach out to someone who knows so that you are not alone in this because it can be lonely.
Yeah, that's a great way to sum up this episode, Jamie. Thank you. And I will see you the next time we get together, and we'll continue to empower women with the genius of their own hormones.
All right. All right. Thanks, Teresa.